Assalamu alaikum. Today we are in lab number 3. Lab number 3 follows the clinic number 3, which is the jaw registration clinic, in which we take the relation from inside the patient's mouth. This jaw relation for the record blocks is then mounted on what we call the articulator, which you have seen in the video regarding articulators and jaw registration. Now, to mount this cast on our articulator for training purposes, we're going to use another method which we call arbitrary mounting. Arbitrary mounting meaning taking the cast as it is and try to center it inside the articulator in a way that it is centered in the middle according to the measurements that we have from our wax rims and so on. So once we want to put this cast and orient it in the middle of this structure, which is the articulator, we have to make sure that we have some reference lines that we're comparing it with. So we're going to go to our cast and use the cast itself to orient our work. If I take this cast and I want to make an orientation for this cast, I want to put it in the center, so I need to know the center of the cast itself. For the centering of the cast itself, I'll take an anterior point and I'll take 2 posterior points. So this is what the procedure we're going to do. So after you have finished taking the measurements and you have made sure that your wax rims are according to the quality that we have explained for, you are going to work on the cast first, then we're going to put this all on the articulator. So what we're going to do, we're going to first know what is the midline point in a cast, an edentulous patient, for example, because this will apply to this patient and many patients where you might be using arbitrary mounting. So what is the structure that is present totally in the midline? So what is the structure that is totally present in the midline? You might say it's the labial frenum. But the labial frenum is a fibrous attachment, and many times in some patients they have had some trauma to it. Some patients, especially those in contact sports, if this is traumatized, it will no longer be in the midline. So we want something more accurate to be in the midline, and we want it to be as a reference point, and this is the incisor papilla. So you need to use a flowmaster, draw the incisor papilla in an elongated manner like this. Okay? So this is step 1. You need another point in the midline as well, and we could use the mid-palatine suture behind the rugae area, and we can draw a small line just over the maximum bulge of it. So these two will orient us on the middle of the cast. So these, even in natural patients, if you want to know if this was not a training model in natural patients and you want to know where is the midline of your cast, you can use these 2 points as a reference. So if I have now drawn these 2 lines, I bring my ruler, put them over these 2 lines, and I would extend, looking from front, maybe. I would bring this ruler over these 2 lines, and while it's in this position, I would be looking at it vertically and then run a line on the cast, on the side of the cast over this. So let us just do it like this. So these are the 2 lines that I have. I want to center the ruler over these 2 lines. I want to orient it in a way that's over these 2 lines. Because the cast is irregular, you need to fix your position correctly. Okay, it's almost here. Okay, so it's almost here. So I have the ruler now lined on both lines. It's running alongside the 2 dots. So this is our ruler ready. And I can now come while looking at the ruler vertically and know where is the midline of our cast. And transfer this mark onto the labial surface of this cast. Okay? So for the cast that we have, it's almost over the labial frenum as well. But this is not the actual situation in many patients, so it's not always corresponding with the labial frenum. Okay? So now I have the anterior midline for this cast. This is the upper cast now. Now I need 2 posterior lines. Why do I need these two posterior lines? Because even if this is in the middle of the articulator, this might be shifting to the left and right. So if I say that I'm going to place this on the articulator, and I make sure that this midline is corresponding with the reference here, but if I'm looking from up here, you would notice that the cast might be shifting to the left or right. Okay, so I might have the anterior correct, but the posterior might be moving. So I want to make sure also that the heel area in the posterior, which is this area, we call it the heel area, I want to make sure this is also centered around the cast. So what I do, I need to draw two posterior lines. My posterior lines are those around the maximum bulge of the crest of the ridge. So if I'm looking at this cast vertically like this, I draw it first on the posterior part of the cast, and then I'm looking closer, where is the crest of the ridge? So if this is the crest of the ridge, over this crest of the ridge I draw a line. So I would know this is the mid of the crest of the ridge of the upper here. I'm going to repeat it on the other, so I'm going to draw this arc shape over this arch of the cast, and then I'm going to look at it vertically and try to determine where is the middle of the crest of the ridge, and this is the line going down here. So now I have these two posterior lines, and these determine the position of the cast, and I'm going to orient them. For the lower, I'm going to repeat the procedure. Bring two lines in the back and one line in the front. So I need to know what is my reference. Once more, if I want to use the labial frenum as my reference, it would not be always correct in many patients. It might be correct on this ideal model, but in many patients it might not be correct, because this attachment is not fibrous as the upper. It is actually muscular. So sometimes some patients, even this is wider than this frenum. So we want something more reliable. And this is the genial tubercle, from which the lingual frenum erupts and goes out. So my line comes from inside, from the lingual frenum. This is the most structure, the most anatomical structure indicating the midline. So it's around this area. Also, I need another posterior line, so I could just take a measurement in between here and here using the ruler, and in midway between these two points touching the slopes of the residual ridge, I could know my measurement. This is around 4.5 centimeters, so somewhere here is my midline. So these 2 points are my references to draw the midline to the anterior. So I'm going to put the ruler over them, looking vertically down over them, and then come down with the pen over the mid of the cast, and this is my midline, anterior midline point on the cast. Here you could notice that for our case, the patient case that we have, or the cast that we have, yes, the labial frenum is a bit away from the midline of the cast. Okay? So now we know the anterior point. We're going to draw now the posterior points. So the same way, we're going to just come back, draw the arcs around here. And here the lower, the retromolar pad is extending posteriorly on this cast, and this is where the maximum height of this arc is, where we have the retromolar pad from this residual ridge, which is the posterior structure for this ridge. Okay, and if I draw this arc as well and go around this arc, the highest point here was also the retromolar pad from this side, and they go down. So now I have one anterior line, two posterior lines. Okay. Now before mounting the lower, as well. I want to make sure that the lower is in correct dimensions. I need to make sure that the wax rim features are all there. And now I have a midline on the cast. I extend this midline on the wax itself. So the two midlines are now coinciding. And also when I want to mount, so this cast is now ready with the base plate on it, and I want to mount it all over the other upper cast, which is already inside the articulator. I put them out of the articulator just to show you how I need to make sure that the midlines come inside. So I would go to the left and right until the midlines of the wax, the casts are coinciding and are all over one line. But even with this point, I could still go to the left and right, even with these lines coinciding. So I'm also going to use the posterior lines to fix the orientation of the cast together. So the midlines are over each other. Then I'm going to, with an overjet, which is around 2 to 4 millimeters, and then I'm going to look from posterior at the wax rims and then compare the posterior lines together. So I'm going to shift the casts from side to side until the lines are distant from each other in the same manner. So I'm going to go to this side a bit here, until they are in the same distance. So what am I'm looking for? I'm looking for the distance, the vertical distance between the cast to be the same. So for example, in this articulator, in this articulation, here the distance is larger from this one. Okay? The distance here is larger than the distance in between the two arcs. That means the wax rim measurements are not the same on both sides. So I have to adjust this wax rim. But suppose that they are in the same distance, I need then to shift to the left and the right and make sure that they are oriented over each other correctly. And now I'm ready to mount the lower. After it's totally fixed, and it should have even contact with the wax rims over each other. They are totally in contact with each other. So these are ready to mount using the articulator. Okay? Now that I have the anterior lines and the two posterior lines ready, I'm ready to put this cast on the articulator after I have checked all of the measurements of my wax rim. So I'm going to place it first in the articulator. For the case we have, which is the case of Abu Mahmoud that we talked about, we're going to raise the pin slightly to have some space for the mounting. So we're going to put the upper member of this articulator that you have identified from the previous video, we're going to put it on the upper slot of the incisal pin. We're going to now mount this on the articulator. So we're going to make sure first that this midline is in the middle using this incisal pin. So if I'm looking from this side, for example, I have to make sure that the midline is with the midline of the articulator. I also want to extend the midline to the wax so I could see it on the jig that I'm going to show you, which you have identified from the previous video. So if this is the midline extended downwards, so this is the midline on the wax rim. Okay, I'll just mark it with another color so you can see it. So this is the midline on the wax as well. So these two midlines coincide. So I want to place this over the articulator. So I open the upper member. Here we have the jig mounted. So I place my wax rim with the cast over this and make sure that this line is coinciding with the midline of the jig. Okay? So this is the midline is over the midline. It's not only that, I also need to close this upper member and then compare posteriorly. So I'm going to look at this cast from posterior. I'm going to compare the heel area. The heel area is the area that we have drawn the arcs on. So this is called the heel area of the cast. And I want to make sure that the cast is not shifted to this side or this side. That is totally centered. So I'm using these two lines that I've drawn from the arc to make sure that they are centered. So here I'm using these two vertical components of the articulator that are running down and trying to compare them with the lines. So if I come with a closer view, I'm comparing these with the lines, so I'm just making sure that my cast is oriented on the articulator. I also want to make sure where is the position of the cast in terms of the upper member, so I'm going to go a little back until I reach the posterior point, where anteriorly the anterior wax is on the midline of the jig. Posteriorly, I'm looking the distance of these two lines from the vertical component running down the articulator are centered. I know they shifted a bit, so I'm going to put them back. And as well, when I'm looking from up here, the cast is shifted slightly to the posterior to accommodate the big cast that we have for this patient. So now this is fixed. I'm sure that now this is the position I want to mount on. So this cast is totally centered inside this articulator, and I'm now ready to do the mounting step, which you will see in the second video. So mounting is fixing the cast to the articulator. So what is the material we're going to use? The material for our selection today will be a plaster. Plaster is the material that will bind to the cast chemically, where crystallization begins from the cast, and it will bind to the articulator mechanically. So the articulator has what we call an upper ring. This is a ring that can be detached, but for the case of mounting, we keep it attached, and it has some locks and irregularities in which the plaster will go in and retain to it mechanically. And we can add some of the plaster a bit over just the margin of this articulator. So in preparation for the mounting, first of all, we take out the cast, take away the base plate, and just soak the art part of it. The art part is not the anatomical part. The art part is the part around the base. It's just for the purpose of design. So we're going to soak this side into the water. Try to avoid having the anatomical surface included in the soaking. All of the members of the articulator using Vaseline except the ring, because we want plaster adhering here. But we don't want plaster adhering on the sides of this, so we paint the articulator using Vaseline. Plane is placed, avoiding the ring area where we need retention. Now the cast is soaked. The function of soaking the cast is that water will go into the crystals on the surface and partially dissolve them. When the new plaster comes and meets the old gypsum, this is stone, but they are all gypsum material. They have the same chemical composition almost. So once we have soaked these crystals, part of them have dissolved and became a bit soft. This soft crystal surface, with partly dissolved, will create a good nuclei of crystallization of the new plaster to it, and it will bind better to the surface. If you don't soak it, the plaster can easily break off the cast in later steps. Also, soaking it has softened the cast a bit, so we are now ready to do notches. The function of these notches that we created in the soft base are orientation notches. Later on in the procedure where we're doing dentures, we will have to take and separate the denture from the plaster mounting and then put it back and reorient it. So these help us, these indentations will be met by the plaster by positive indentations going in. So what if we take those two parts apart and put them back, we can easily reorient them. We'll see it in the final product. So we're going back with the wax rim in place. Midline over the notch, centering the cast jig, closing this upper member, making sure the pin is fixed in location and it meets the incisal table of the articulator. We have clearance between the cast and the upper member, and now we're ready to do the mounting. Now once everything is ready, we make our mix. It's a mix of plaster, and it's a bit heavier than the mix we have made for the impressions. So once it's smooth, we add it to the cast immediately. So we open the upper member of the cast. We add it over the soaked cast that has been soaked previously. And this is why we told you please write your names on the back of the cast, because the names that you have written on the base will disappear under the mounting material. And we squeeze into place, making sure that it's still centered. Once we squeeze into location, we want to make sure that we have totally closed, so the incisal pin should meet the incisal table. So that's now correct. The table is meeting the pin. And now we begin with the cast is centered in the middle and centered around the upper member. And we begin using this consistency, which is a bit thick, as we told you, to carve away the plaster. We carve away the plaster, making sure it's connected from the cast to the ring only. Any excess is removed all around. Then once all excess is removed, you can use your wet fingers to further smoothen and remove excess and smoothen the mounting, making sure that the plaster went into the indentations we have carved in the cast. You can see how the plaster went and covered those indentations. We clean the cast from all sides and wait for it to set, ready for the lower mounting. And we could wipe away the excess plaster over the articulator member using a wet napkin. Today we're going to talk about the quality of your mounting. How are we going to judge your quality of mounting, okay? So most of you have finished mounting the upper successfully, and now you're going to work with the lower. So to ensure that the upper is correct, we're going to give you some guidelines on how to judge your arbitrary mounting. We are using here arbitrary mounting, meaning that we are using only a mounting jig. We are using the wax rims made to the average values that we have given you. And we're going to mount according to an average value articulator, the articulators that you have, okay? So if I look closely at my mounting, I'm looking at an articulator with casts attached to it, okay? So I'm going to talk about this attachment. There are some general outline or rules that we need to observe while we're working with the articulators and mounting. We need to make sure that all of the articulator members are clean. So this is what we're going to judge you by. So if you write down these notes, it will be useful for you to mark yourself before you come and you evaluate yourself before you come to us to evaluate you. Okay? So we're looking at general points. These are the cleanness of the articulator. We want your ID clearly written. So please write your name on the side of the cast, on this side. We want the articulator itself to hold a name tag like this. See this name tag? Okay? So we have a name tag attached with your name on it. And we also would like to see your name also on the base plate itself. Okay? So if this was a base plate, okay, this base plate, I would like to see your name. It's preferred to be on the bottom of the upper and the lower, on the fitting surface, okay? So it's on the fitting surface. So write down your names clearly on each part of your articulator and your work. This will be easy for us to identify you. We also want to see, then these are the articulators. The cast should be free of plaster. And the wax rims and base plates should be free of any plaster, okay? Now for the upper, how we're going to judge the mounting of the upper. If we're going to look at the upper, the first thing we need to check is the midline. So I need on each cast to have a clearly drawn midline on the cast and on the wax rim to make sure that this midline is corresponding with the midline reference on the articulator. What do we have as a reference here on the articulator? For the midline, anteriorly, what do we have on the articulator? Do you see this notch? The V-shape notch on the jig itself? This determines where is the midline. So this is our reference for the midline. We have another reference is the ring, the incisal pin itself. We make sure that the midline on the wax is corresponding with the incisal pin. And we also sometimes have a pointer. Does anyone have the pointer? You have midline pointers and you have what we call infraorbital pointer. We're talking about midline pointers. You'll take these information of parts of articulator in the lecture, but this is the midline pin. And we orient it in a way, we try to tilt it in a way where it's heading immediately to the midline. Okay, why do I need it as an extra? Because the incisal pin is far away from the midline. We want something closer. This is one reason why we use it. Okay, we want something closer to the wax rim. And remember that in the second step, we are going to remove this jig. So we no longer have this reference as a midline. So we use the pointer as our midline. Okay, so the pointer will be indicating where is the midline. So during the setting of the teeth, I don't lose it, because also the wax midline will also be removed. So we're looking to make sure that the midline is centered. So I could use the reference from the cast and the wax rim here, or I could use the external line that we have got from the patient face if we have the clinical step, which we don't have because we're talking only about lab procedures in this semester. But if I have the midline from the patient's face on the upper wax rim, I extend it to the lower. Simply I extend the line and carve in the wax this line. I could extend it into the lower wax rim. Okay? So this is how we determine midlines. So once we are mounting, we want to make sure that our mounting is correct. So what we're looking at, first of all, is the midline. Okay? So all of this was explaining only the midline. Midline of the cast and midline of the anterior wax rim should correspond with the articulator midline references. اللي هي notch in the jig, the pointer, or the incisal pin for the midline. Then after judging the midline, we're going to judge the posterior edge of the cast. We want to make sure that when we're looking down, if you look down on your cast from up, down, we want to make sure that the distance between this side and this side is the same. Okay? It's not shifted to the left or right. So this is our second reference for the upper. I could also look at the upper from behind. Okay? So let's go back to the mounted cast. If I'm looking at this cast from behind, okay, try to give you a posterior view. I also could see that the cast, if I'm looking at the cast or looking at the ridges, this is centered. I'm trying to compare by looking down on this. I'm trying to compare the distance between these ridge areas and the metal components of the articulator. This distance from here, from this point down, and this point down, if I'm looking totally vertically on this, it should be centered. So I also could use this, looking at the articulator from behind. The cast is not shifted to one side or another. You can see it here better with the unmounted cast yet. But watch here. Okay, this still is unmounted. But look how sometimes you have a shift. See this ridge compared to the upper member of the metal? Okay? يعني قارنوا الميتال مع الridge location. So this is shifted to the left or right. It's centered when the ridges are in equal dimension, equal distance from these metal members in comparison. It's not shifted to the left. It's not shifted to the right. Okay? So this is for the upper. This is how we are going to judge your upper mounting. And now once it's set and we have cleaned all of the members, they are back to clean, we are able to open this securely. And now we have the upper member here. For mounting the lower, we are going to first take off our mounting jig. This is a removable part. There is a screw beneath your articulator where you can just unscrew it. And we're going to attach, instead of it, another ring that comes with the articulator. The ring will not go into position until these indentations go into the depressions that are opposite to them. So we make sure they fit into their depressions. Now we can secure the screw. And now we are ready to do the mounting of the lower. For the lower to be mounted, first we're going to invert the articulator. Now it's upside down. And we're going to place the lower according to measurements. So we are still using the average mounting. But if this was a patient case, we would have the upper and lower wax rims fixed from inside the patient's mouth. Inside the patient's mouth, after we adjust the upper wax rim and everything is okay, we add the lower end, let the patient bite with a sticky material in between, and this will hold it in place. But in our case, we don't have a patient, so we're going to put it in an average. So first of all, we take out the cast. We're using the wax rim only. We're trying to center the wax rim, the lower wax rim over the upper. And how do we verify it? If we look vertically here, we are looking that the base plate from the left and right is centered over the lower cast as well. So this is the lower base plate, and this is the upper cast already mounted on the articulator. We make sure it's not tilted to the left, not tilted to the right, not going back, not going too much further anteriorly. We only go back enough to have what we call an overjet, which is the distance between the central incisors of the upper and the central incisors of the lower. They're not in the same line. So we center it. So it's now centered. If you look vertically once more, centered. And also we make sure if we look from the side here, this side, you can see that the heel, what we call the heel, this is the base plate going over the retromolar pad area. Remember that the retromolar pad is going vertically. So its base plate will also go vertically. So we want to make sure that this heel area, which was over the retromolar pad, is not hitting the lower base, and it's clear from the wax. And this was the main function of the bevel we made here. We made it to make sure that this base plate going vertically does not hit over the wax. We want the base plate clear, and we want a totally intact surface between the lower wax rim and the upper by having both occlusal tables totally flat. So once it's centered, I'm using my vision here, vertical vision. I'm also looking at it from posteriorly. If you look at it from the posterior, you find that the ridge is centered over this. So it's centered and a bit more interior to make the overjet exactly 2 to 4 millimeters. And now this is ready to be mounted. But because it is a bit light and it can move around, we need to fix it into place, making sure that it will not move while we're placing the cast and mounting the procedure. So we use the sticky wax, we heat it on the flame, and we let it drip in between the two members. So if I'm looking from this side, After I have centered it, I use my sticky wax and let the sticky wax drip into place, fixing the upper and lower members together into location. In the case of the patient, we would have this fixed from the clinic. The upper and lower are fixed to what we call retruded contact position in the patient's mouth. But here we're going to fix it with a sticky wax. And now it's a bit firm in place. So once I'm going with the additional steps, I could easily put them. For the lower cast, we're going to repeat what we have done in the upper. I'm going to soak this part, the base of the cast. I'm going to do the notches, 1 anterior, 2 in the posterior, and come back and put it into place and then begin mounting. Now, after soaking the base of the plate and placing the notches and making sure it's clear from the articulator, not hitting the member of the ring which is close to it, we add our plaster. So once more, we add it on the base. We cover the base. We make sure we go into the notch areas. And we will make it in a consistency that it is a bit firm. And then once we mount it over the cast, we squeeze the articulator over it. So we're going to close our articulator, and our clue that the articulator has closed, that the pin is on the table back. Okay, they fit. And now, using the consistency, we could just wipe away the excess, making the cast and the ring in one line. So the cast is now continuous with the ring. Any excess going to the outside or bulging between the cast and the ring is removed. Once it's smooth, we're going to wet our fingers using some water and wipe away and smoothing the surfaces in between. If we have any deficiency, we could just add a bit and fill it in. We make sure the notches are filled in with plaster material, and then while wiping away the excess, we compress the plaster to the cast once more, filling in the gaps. We repeat this all around, and this is the mounted cast ready for the setting of the teeth. We should not invert the articulator, unless the plaster is set, and that is around 10 to 15 minutes until it can withstand the inversion of the articulator. If we invert it now, what will happen that it will slump away from the cast and the cast will move in location. So we want to make sure to keep it upside down. The articulator is upside down up to the end of the setting of the plaster. And this is the work you're going to submit at the end of this lab. Thank you.